Okay, pulsatile perfusion in CPB. Pulsatile perfusion means delivering blood flow in pulsing wave-like pattern, similar to how heart pumps naturally instead of smooth continuous blood flow during CPB. In short, pulsatile perfusion is artificial creation of heartbeat-like blood pulse during CPB instead of laminar blood flow. In this video, we will cover the physiology of pulsatile flow in the body, the advantages and disadvantages of pulsatile perfusion in CPB, which patient it benefits the most, and in which patient it should be avoided. Let's start with the physiology of pulsatile flow in our body. In our body, the heart never delivers blood as a smooth continuous stream. Instead, every heartbeat creates pulse wave. We call it a pulsatile arterial flow. It is a rhythmic flow of blood through the arteries that is caused by beating of the heart. The heart pumps blood into the arteries during systole, and the arteries expand to hold the increased blood volume. And during diastole, the heart relaxes and the arteries contracts, which reduces the blood volume in the arteries. This rhythmic expansion and contraction of the arteries creates pulsatile flow of blood in our body. There are many roles of this pulsatility. This stimulates the inner lining of the arteries, the endothelium, to release nitric oxide, which maintains vascular tone. Also, the pulsatility maintains microcirculation by ensuring capillaries open and close dynamically. Pulsatile flow maintains healthy organ perfusion, especially in kidney, liver, and brain. Now, during CPB, if we use standard roller or non-pulsatile perfusion mode, we generate flat continuous flow. This is not the same as natural physiology. To avoid this, there is a pulsatile perfusion in CPB, but it has its advantages and disadvantages. First, we discuss about advantages of pulsatile perfusion in CPB. First is improved microcirculation. Pulsatile flow reduces vascular resistance and improves blood delivery to tissue at the capillary level. Second is better organ protection. Research and clinical practices have shown that organs like kidney and brain show improved perfusion with pulsatile flow, and also lowers the rate of post-operative neurological dysfunction and has a better neurological outcomes. Third is lower systemic vascular resistance. Pulsatile perfusion increases shear stress on endothelial cells lining the vessels, which activates endothelial cells to release vasodilator molecules, such as a nitric oxide, which maintains the normal vascular tone. Fourth is a better oxygen delivery. Pulsatile perfusion can enhance the oxygen delivery to the tissue due to its ability to create pressure gradient that facilitates the oxygen diffusion from the blood vessels to surrounding tissue and improves the oxygen delivery to tissue. Fifth is a reduced risk of microemboli. Pulsatile perfusion helps to reduce the formation of microemboli by its flow dynamics, which helps to prevent the loading of microparticles in small vessels. Overall, pulsatile perfusion makes the CPB hemodynamics more similar to natural beating of heart, which may reduce the stress response and inflammatory mediators. Okay, now disadvantages of pulsatile perfusion in CPB. First is technical complexity. Generating pulsatility requires additional modification in pump setting, which adds complexity in perfusion management. Second is increased hemolysis. Pulsatile pumps may cause higher mechanical stress on red blood cells, leading to more hemolysis. Third is noise and vibration. The pulsatile mode sometimes creates the more turbulence in the circuit, which can affect the monitoring accuracy. Fourth is the inconsistent benefits. Not all the studies agrees on the advantages. In some cases, outcomes are not significantly different compared to the non-pulsatile perfusion. So as a perfusionist, deciding using a pulsatile perfusion is a very practical question to address. So we will see in which patient pulsatile perfusion is recommended. First, pediatrics and neonates. Their organs, especially the brain and kidneys, are more sensitive to the microcirculatory flow. Second is the patients with compromised renal dysfunction, to reduce the risk of post-operative renal injury. Third is the patients undergoing prolonged bypass. Long bypass time increases the risk of organ dysfunction, so pulsatility can help. Now, when should we avoid the pulsatile perfusion in CPB? Patients with severe aortic dissection or aneurysm, because pulsatile high pressure wave may worsen the condition. Second is patients with fragile vascular graft, because pulsatile flow can stress the vessel wall. Third, in emergency and short bypass cases. In short bypass cases, there is no shown benefits of adding this complexity in CPB. Ultimately, whether to use pulsatile perfusion or not depends on the patient, type of surgery, and the perfusionist judgment.